Actually, Dr. Hina, she informed me
Hi.
she will join. Okay,
Yes,
you're here.
yes.
So your history is constipations. That is, so suppose a 4 years age child, mother complains she has some diarrhea. That is your complaint. You have to
Mhm.
take the constipation history from this.
Mm. All right. Can I get a few minutes to prepare?
You want to start or take time? She is Sarah, 4 years age old. Mother is Fatima.
Okay. Can I take a few minutes to prepare?
Okay, okay, okay.
Okay. Yeah, I can start now. Mother is Sarah. Okay.
Is hello. Your
Hello.
voice is very low to me. I don't know.
How about now? Can you hear me now?
Yes, yes, now better, much better. Thank you so much.
Yeah.
Your voice, you want to take your microphone, I think, near. Hello?
Yeah, I'm taking very near to me. How about
Is
now?
it
Can you hear me
okay?
now?
Okay, now it's improved and nice.
All right.
So you want to start like wait, I want to keep the time. Okay.
All right. Hello, good morning.
Good morning.
Hi, I'm Dr. Teresa, one of the child outer here. Am I talking to Sarah?
Yeah, I'm Sarah is a 4 years age old. I'm Fatima. You're talking both.
All right. Thank you for coming to see me. I understand that you came here because you have a little bit concern about Sarah. Am I correct?
Yes, doctor, I have some concern about Sarah.
All right. First of all, can I just confirm your name, please?
I'm Fatima,
Okay. Is that
Sarah's
okay if
mom.
I call you Fatima?
Yes.
All right. Okay. How may I help you, Fatima?
So, doctor, Sarah have a problem of constipations, but now suddenly it starts as a diarrhea. That
Oh,
is,
I'm
I want
sorry
to
to
get
hear
rid of
that.
this problem.
Oh, yeah. No worry. We are going to help that. You mentioned Sarah is having diarrhea before that constipation happened. So, can you tell me how long Sarah has this constipation for?
When she is like 2.5 years or 3 years, she started these constipations. First, it was not that much severe, but last 6 months it really suffering me. And Sarah recently started her nursery, and it creating problems, doctor.
Okay, so let's say when Sarah have started nursery, you feel like constipation has been worsened. Can you clarify me how many day in a week can Sarah open the bowel within this
She
six
opened
months?
the bowl like weekly, sometimes once or sometimes twice.
Only once or twice in a week. All right.
Mm.
And when she passed the poo, has he ever cried or any blood have you noticed in the poo?
Yeah, when I weeping, I sometimes notice there is blood, and she cry. She's not interested to go toilet.
Oh, that must be really hard for Sarah. I understand now. And have you ever when you check the poo, can you describe the nature of the poo? Is this like a rapid drops or what is it like?
It just look like bunch of grapes, I think.
Oh, it look like a bunch of grapes. Okay. And you mentioned Sarah is having diarrhea. So how long that Sarah is having diarrhea for?
Well, sometimes she start diarrhea.
Hmm. Okay. So
Flop.
it's been like okay. Yeah. Please go on. Yeah, Fatima.
Yes, recently started like 3 weeks. I noticed.
Okay, 3 weeks started. And has this kind of constipations and diarrheas alternating has been present for over 6 months, or only this diarrheas happens only these 3 weeks
And yes, this last 1 month I'm noticing the alternating diarrhea, and before that it
oh,
was constipations.
only? All right. And can you describe the poo nature? Why Sarah is having this diarrhea?
I don't know. I think it's overflow something. Hard stool.
Mm. And how many times a day Sarah has been going for the toilet these 3 weeks?
Yes, she go. I take her. But she cries. She's not interested to go there. 3 or 4 times I take her for pee.
Is there all right, I understand now. Is there any accident happened like Sarah has passed the poo accidentally? Has everything ever happened?
Not accident. Actually, sometimes there is some staining on her underwear when she goes to the school, and it
Mm,
really embarrassing, I think.
of course, of course. And how many times have you noticed this?
The last 6 months, sometimes monthly she's doing monthly once or twice.
All right. It have is there any kind of very profuse poo accidentally pass out apart from the staining on the panty? Have you
Mm,
noticed ever?
It's once happened in the home, but on school that is like staining on the underwear.
All right. Okay. And you mentioned this kind of constipation worsened after Sarah has been to the nursery. Is there any problem, Sarah, going to the toilet at the nursery?
No, but
So
she's
she can
normally not
go.
interested to go toilet.
Why? Is there any particular reasons for that?
No, I don't think I feel she feels pain. That's why.
All right, okay. And okay, thank you so much. So now I want to ask you about a little bit of general health. Does Sarah has any problem with tummy, like any distension of the tummy?
No, yeah, when that constipation increase, I think her tummy also distended.
And do you notice any kind of movement, like abnormal wavy movements over the tummy these days?
No,
Nothing like that. Any pain that Sarah complained, like tummy pain?
yeah, sometimes she complained tummy pain.
Where exactly can she point out the tummy?
Whole tummy.
The whole tummy. And does the pain is like continuously, or does you try anything to relieve with the tummy pain?
No, not needed actually. If she in time pass the stool, and I think it get relieved.
Okay, all right. And along with that, have you ever noticed Sarah is having any sickness, any throughout?
No, there is no any throughout.
Is there any fever or temperature recently?
No,
All right. And does Sarah has any change in term of skin colors, like change in color of skin?
no,
Okay. What about the weight? In terms of weight, do you satisfy with Sarah weight?
it's okay. I think.
Okay, let's move on the diet appetite. How do you say about Sarah appetite?
Yeah, she's a good appetite. She's very much interested about sausage, nugget, and the sandwich. These are her favorite food.
It's look like she's having a quite fast food fan. What about
Yes.
vegetable intake? Does she like
Oh,
eating
that's a
vegetable
fighting.
fiber?
She's not interested to take any vegetables. She only
All
want to
right.
interested for fast food.
Okay. And what about liquid or any fluid that she prefer having?
No, no, she is also not drink sufficiently, I think.
All right. And have you tried anything to help with this diet pattern with the GP or anyone else?
Yeah, previously once we have visited the GP, then GP tell her to give fiber containing diet. But Sarah is
Mm-hmm.
not interested, and that's why.
So you give up. Okay. It can be sometimes child can be choosy eaters. Okay. So let me ask a few questions. Does Sarah said any problem with breathing, any cough,
No,
any chest pain, any awareness, like any heart beating?
no,
Okay. Is there any complaint Sarah make you like he's having headaches?
no,
Any blurred visions?
no,
Do you notice any spot over the skin, like back area?
no,
Oh, that's great. And what about the joints or muscle? Has Sarah ever complained of any pain?
no, there is no any pain.
All right. So Sarah is right now 4 years. So he should play well with other children. And can she play with other children?
Yes, she play. She's playful.
That's really great. So in terms of the activities, is there any concern you have with Sarah?
No, I have no any concern.
Oh, that's perfect. What about the gait? Do you have any concern in terms of Sarah walking gait?
No, she worked nicely. No
That's
problem.
perfect. That's perfect. Let me ask you about the pee. Sometimes children with the poo problem have a problem with pee. Has Sarah says any problems with going to toilet for pee?
Not any concern about pee.
No concern. All right. Is there any past medical history apart from this constipation? Is there any other past medical history that Sarah's have?
Actually, she is suffering these constipations. Otherwise, I have no any complaint.
Oh, that's really great. Any hospital admission before?
There is no any hospital admission.
Oh, very good. All right. And any surgery has Sarah's had in the past? Hello.
No.
All right. Okay. All right. So, I want to ask you about the medications. Have you tried any medications currently for the Sarah's problem?
No, doctor actually tell us some behavioral and tell that to take the fiber diet, increase the fluid intake. After that, it not improves, they refer us.
All right. So you have only tried diet modification, but that hasn't been successful so far yet. So you came and see me.
So we
Don't
tried, but
worry.
Sarah is not interested to take this type
Oh,
food.
okay. Okay. Let's see how we can help in terms of Sarah problem. Let's move back to the birth history. When the Sarah's how did Sarah born? Like normal
9 minutes.
vagina?
Yes, yes,
Okay.
she's normal vagina delivery.
And what time does Sarah pass the poo after the bath?
But she passed the poo, no problem occur.
Oh, that's great. And any problem happen during the neonatal period?
No,
All right. What about immunization? Do you have any? Is Sarah has been up to date with her jab?
taken all the jab. 10 minutes.
Okay, that's great. Is there any family member have similar problems with the poo problem?
No, I we have family member has no any poo problem.
Okay, thank you so much. Also, Miss Fatima, I understand that yeah, take a lot of your time, but it's really important in order to help the Sarah. Is there any other concerns you have that I might miss asking you?
No, okay.
All right, thank you.
Can you? So you have remained 3 minutes.
Mm-hmm.
3 minutes remain.
3 minutes remain. So
Okay.
I will not ask any question. Finish.
Okay, then you have to present your case, please.
All right. So today I took the history from Fatima. She is the mother of Sarah's 4 years old child. Sarah is having a problem with constipation followed by overflow incontinence. She has been having these problems for about a few years, but currently it's been worsened over 6 months. On the history, I consider Sarah's diet has not been proper. She is eating a lot of fast food and no vegetable fluid intake. There isn't any problems of reflex symptoms such as neurological abnormalities. There isn't any problem with musculoskeleton, though I haven't asked about the endocrine problems like hypothyroid features. If I have a time, I would probably ask about that. So, based on the history, I believe Sarah is having a constipation, likely because of the diet problems.
Okay, in presentation you already mentioned that I have not asked about endocrine anything. So you need to ask now.
Yeah,
Constipation
I
is
forgot.
related to us. You
Yeah,
ask
yeah.
one's weight. What about her weight? Any weight loss occur? Actually, I feel like that. And school performance, you have to ask social, psychological history is very important here. She is
Yes.
going nursery. How
Mm,
this is affecting you? Is 3 minutes remain you have? How this
yes.
affected your family? How Sarah is on bullying because she has soiling occur. That's why
Mm,
she is not interested now. Go to the nursery. I will tell you that. That is also important. Okay. And another thing, allergy history you have not asked. Any cow's milk allergy, that is also need
mm,
to exclude.
yeah.
And one thing, your history of present illness was very nice. You ask everything. And Bristol chart, you also ask how is the rabbit shape. That is, you ask maybe. I tell you another shape. Okay, branch of grape. Another, when she goes to toilet, does she has any behavioral crossing the legs, any
Mm,
back problem? Okay,
mm,
this also need to ask. Otherwise, you ask everything
okay, thank
nicely.
you.
So, how
Mm.
can you manage this patient? What are the red flag of constipations?
But not passing the poo immediate after bed, 24 hour within 24 hour after bed, and loss of weight, loss of appetite, also the neurological symptoms.
Again, your volume is low. Hmm.
Okay. neurological symptom, blood in the poo, loss of weight, loss of appetite, and then meconian iliac history. After the birth, she hasn't passed the poo. Those are the
Okay.
red flags.
So red flags are very important in constipation, any history. This is early onset of constipations, any faltering growth, neuropathic bowel, Hirschsprung's disease, anterior anus, anal stenosis, delayed cow milk protein allergy in first 3 years of life. And what examination we do? Weight and height. Abdominal examination, if not painful, abdominal distension, fecal mass, scar of Hirschsprung's correction, or colostomy. We search in abdominal examination. Also inspection of the perianal area, appropriate position of the anus, or evidence of streptococcal infections. Spine and lower limb neuromuscular examination, spina bifida. Everything you find handwritten note, I already send you. And treatment, some objective, that is education, diet and lifestyle, behavioral management, medication, supporting child and family. So this is management. Otherwise, okay, the history. And last one is our, no, sorry, last one. We have also development need to do. Development, we